Understanding treatment-resistant depression, TRD. Introduction. Treatment-resistant depression, TRD, is a form of major depressive disorder, MDD, that doesn't respond to standard treatments such as antidepressants and psychotherapy. This condition poses a significant challenge to patients and healthcare providers due to its persistent nature and the severe impact it has on individuals' quality of life. Prevalence. It is estimated that up to 30% of individuals with major depressive disorder may experience treatment-resistant depression. This high prevalence underscores the need for alternative treatment strategies and a deeper understanding of the condition. Characteristics and diagnosis. Definition: TRD is typically diagnosed when a patient has not responded to at least 2 different antidepressant treatments, each given at an adequate dose and duration. Symptoms. Symptoms of TRD are similar to those of major depressive disorder and can include persistent sadness, loss of interest or pleasure in activities, changes in appetite and sleep patterns, fatigue, feelings of worthlessness or guilt, and thoughts of death or suicide. Potential causes. The exact cause of TRD is not well understood, but several factors may contribute to its development. Genetic factors. Genetic predispositions can make some individuals more susceptible to depression and less responsive to standard treatments. Biological factors. Imbalances in neurotransmitters like serotonin, norepinephrine, and dopamine may play a role. Additionally, structural and functional brain abnormalities could contribute. Psychosocial factors. Chronic stress, trauma, and adverse life events are significant contributors to the persistence of depressive symptoms. Medical conditions. Co-occurring medical conditions such as chronic pain, thyroid disorders, and neurodegenerative diseases can complicate depression treatment. Treatment approaches. 1. Medication adjustments. Switching to different classes of antidepressants, combining medications, or augmenting with mood stabilizers, antipsychotics, or other agents can sometimes help. 2. Psychotherapy, cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, and other forms of therapy can be effective, especially when combined with medication. 3. Electroconvulsive therapy, ECT. ECT can be highly effective for severe TRD, although it is often reserved for cases where other treatments have failed. 4. Transcranial magnetic stimulation, TMS. TMS uses magnetic fields to stimulate nerve cells in the brain and has shown promise in treating TRD. 5. Ketamine infusions. Low-dose ketamine infusions or esketamine nasal spray are newer treatments that have demonstrated rapid antidepressant effects. 6. Lifestyle modifications. Regular physical activity, a healthy diet, adequate sleep, and stress management techniques can support overall mental health and enhance the effectiveness of other treatments. Future directions. Research is ongoing to better understand TRD and develop more effective treatments. Areas of focus include personalized medicine, tailoring treatments based on genetic, biological, and psychosocial profiles. Novel therapies, investigating new medications and innovative treatment modalities. Biomarkers, identifying biomarkers that can predict treatment response and help guide therapy decisions. Conclusion. Treatment-resistant depression is a complex and challenging condition, but ongoing research and advancements in treatment are offering hope. Individuals with TRD require comprehensive and personalized care, often involving a combination of therapies. If you or someone you know is struggling with TRD, it is important to seek help from healthcare professionals who specialize in managing complex depressive disorders. With persistence and the right approach, it is possible to find relief and improve quality of life. Living with treatment-resistant depression, TRD. Introduction. Living with treatment-resistant depression, TRD, can be an overwhelming and challenging journey. Unlike typical depression, TRD does not respond to standard treatments such as antidepressants and psychotherapy, making it a persistent and often debilitating condition. However, understanding TRD and exploring various strategies can help individuals manage their symptoms and improve their quality of life. Emotional impact. The emotional toll of TRD is profound. Individuals may experience persistent sadness. Despite treatment efforts, feelings of deep sadness and hopelessness can linger. Frustration and despair. Repeated treatment failures can lead to feelings of frustration, discouragement, and a sense of being misunderstood or unsupported. Isolation. TRD can cause individuals to withdraw from social interactions, leading to loneliness and isolation. Guilt and self-blame. Patients may blame themselves for not responding to treatments, exacerbating feelings of worthlessness and guilt. Daily life challenges. TRD affects various aspects of daily life, including work and school. Concentration difficulties, fatigue, and lack of motivation can hinder performance and productivity. Relationships. The strain of living with TRD can affect relationships with family, friends, and partners, often leading to misunderstandings and conflicts. Physical health. Chronic fatigue, sleep disturbances, and changes in appetite can impact overall physical well-being. Self-care. Maintaining self-care routines can be challenging, contributing to a decline in personal hygiene and self-esteem. Coping strategies. 1. Seeking professional help. Specialized care. Consulting with mental health professionals who specialize in TRD is crucial. They can offer advanced treatment options and a comprehensive approach to care. Therapy. Engaging in psychotherapy, such as cognitive behavioral therapy, CBT, or dialectical behavior therapy, DBT, can provide valuable coping skills and emotional support. Medication management. Collaborating with a psychiatrist to explore different medication combinations or alternative treatments like ketamine infusions or esketamine nasal spray. 2. Building a support network. Support groups. Joining support groups for individuals with TRD can provide a sense of community and understanding. Open communication. Sharing your experiences with trusted family members and friends can foster empathy and support. Professional support. Regular check-ins with mental health professionals can help monitor progress and adjust treatment plans as needed. 3. Self-care and lifestyle adjustments. Routine. Establishing a daily routine can provide structure and a sense of control. Physical activity. Regular exercise, even in small amounts, can boost mood and energy levels. Healthy diet. Eating a balanced diet rich in nutrients supports overall well-being. Sleep hygiene. Prioritizing good sleep habits can improve mood and cognitive function. Mindfulness and relaxation. Practices such as mindfulness meditation, yoga, and deep breathing exercises can help reduce stress and enhance emotional resilience. 4. Exploring alternative treatments. Transcranial magnetic stimulation, TMS. TMS uses magnetic fields to stimulate brain regions involved in mood regulation and has shown promise in treating TRD. Electroconvulsive therapy, ECT. ECT can be effective for severe TRD, providing rapid relief for some individuals. Innovative therapies. Staying informed about new and emerging treatments, such as psychedelic-assisted therapy, can offer additional options for those struggling with TRD. Finding hope. While living with TRD is undeniably challenging, it is important to hold on to hope. Advances in mental health research are continually providing new insights and treatments. Additionally, the support of compassionate healthcare professionals, family, friends, and peer groups can make a significant difference. It is crucial to celebrate small victories and remain open to exploring different approaches to managing TRD. Conclusion. Living with treatment-resistant depression requires resilience, patience, and a multifaceted approach to care. By seeking specialized help, building a strong support network, practicing self-care, and exploring alternative treatments, individuals with TRD can find ways to manage their symptoms and improve their quality of life. Remember, you are not alone in this journey, and there is always hope for better days ahead. Treatment-resistant depression options, exploring pathways to relief. Introduction. Treatment-resistant depression, TRD, is a form of major depressive disorder that does not respond adequately to at least 2 different antidepressant treatments given at appropriate doses and durations. Despite the challenges posed by TRD, numerous treatment options are available that can provide hope and relief for those struggling with this condition. Below is a detailed exploration of various TRD treatment options, ranging from established therapies to emerging interventions. Number 1. Medication strategies. A. Antidepressant combinations. Switching antidepressants. If a patient does not respond to one antidepressant, switching to another class, for example, from an SSRI to an SNRI, might be effective. Combination therapy, using 2 antidepressants together, such as an SSRI with bupropion, can sometimes improve efficacy. B. Augmentation strategies. Mood stabilizers. Medications like lithium or lamotrigine can be added to an antidepressant regimen. Antipsychotics. Atypical antipsychotics, for example, aripiprazole, quetiapine, can be effective as augmenting agents. Thyroid hormone, adding liothyronine, T3, can enhance antidepressant effects in some cases. C. Novel antidepressants. Esketamine, administered as a nasal spray. Esketamine offers rapid antidepressant effects, especially for those with TRD. Ketamine infusions. Intravenous ketamine is another fast-acting option that has shown promise in clinical settings. Number 2. Psychotherapy options. A. Cognitive behavioral therapy, CBT. Individual CBT focuses on changing negative thought patterns and behaviors. Group CBT provides a supportive environment to learn and practice coping skills. B. Dialectical behavior therapy, DBT. Originally developed for borderline personality disorder, DBT is effective in managing emotions and reducing self-destructive behaviors, which can be beneficial for TRD patients. C. Interpersonal therapy, IPT. IPT focuses on improving interpersonal relationships and social functioning, which can alleviate depressive symptoms. D. Acceptance and commitment therapy, ACT. ACT encourages individuals to accept their thoughts and feelings rather than fighting them, fostering psychological flexibility and resilience. Number 3. Brain stimulation therapies. A. Electroconvulsive therapy, ECT. ECT involves the application of electrical currents to the brain under anesthesia, leading to rapid improvement in severe depressive symptoms. B. Transcranial magnetic stimulation, TMS. TMS uses magnetic fields to stimulate specific brain regions involved in mood regulation. It is a non-invasive procedure with a growing body of evidence supporting its efficacy. C. Vagus nerve stimulation, VNS. VNS involves implanting a device that stimulates the vagus nerve, which can influence brain regions associated with mood regulation. It is typically considered when other treatments have failed. Number 4. Lifestyle and alternative therapies. A. Physical activity. Regular exercise has been shown to improve mood and overall well-being. Activities like walking, running, and yoga can be beneficial. B. Nutrition and diet. A balanced diet rich in omega-3 fatty acids, vitamins, and minerals can support mental health. Consulting a nutritionist may help in developing a dietary plan. C. Sleep hygiene. Maintaining a regular sleep schedule and creating a restful sleep environment can significantly impact mood and energy levels. D. Mindfulness and meditation. Practices such as mindfulness meditation, yoga, and deep breathing exercises can reduce stress and improve emotional regulation. Number 5. Emerging and experimental treatments. A. Psychedelic-assisted therapy. Research into psychedelics like psilocybin and MDMA for TRD is showing promising results. These substances, used in controlled settings with therapeutic support, may offer new avenues for treatment. B. Neurofeedback. Neurofeedback involves training individuals to alter their brain activity through real-time feedback, which may help in managing depressive symptoms. C. Deep brain stimulation, DBS. DBS involves surgically implanting electrodes in specific brain areas to regulate abnormal activity. It is an experimental treatment showing potential for severe TRD cases. D. Hormone therapies. Investigating the role of hormonal imbalances, such as cortisol or estrogen, and correcting these imbalances may provide relief for some TRD patients. Number 6. Integrative and holistic approaches. A. Complementary therapies. Acupuncture, massage therapy, and chiropractic care can complement traditional treatments and promote overall well-being. B. Herbal supplements. Some individuals find relief using herbal supplements like St. John's wort, SAMe, and omega-3 fatty acids. However, it's important to consult with a healthcare provider before starting any supplement. C. Peer support and community programs. Engaging with support groups and community programs can provide emotional support and reduce feelings of isolation. Number 7. Personalized medicine. A. Genetic testing. Pharmacogenetic testing can help identify how an individual's genetic makeup influences their response to medications, allowing for more personalized treatment plans. B. Biomarkers. Research into biomarkers for depression aims to identify biological indicators that can predict treatment response and guide therapy choices. Conclusion. While treatment-resistant depression presents significant challenges, there are numerous options available to explore. It often requires a combination of treatments tailored to the individual's unique needs and circumstances. Consulting with healthcare professionals who specialize in TRD is crucial in developing an effective treatment plan. By staying informed about emerging treatments and being open to a holistic approach, individuals with TRD can find paths to manage their symptoms and improve their quality of life. Remember, persistence and hope are key components of the journey towards recovery. Ketamine treatment for depression, a revolutionary approach. Introduction. Ketamine, once primarily known as an anesthetic and a party drug, has emerged as a groundbreaking treatment for depression, particularly treatment-resistant depression, TRD. Unlike traditional antidepressants, ketamine offers rapid relief from depressive symptoms, making it a beacon of hope for many who have not responded to conventional therapies. What is ketamine? Ketamine is a dissociative anesthetic that has been used in medical settings since the 1960s. It works primarily by blocking the NMDA receptor in the brain, which is involved in glutamate neurotransmission, a critical pathway for mood regulation and cognitive functions. Ketamine's mechanism of action. Ketamine's antidepressant effects are believed to stem from its unique mechanism. Glutamate modulation. By blocking NMDA receptors, ketamine increases the levels of glutamate in the brain. This triggers a cascade of events that enhance synaptic connectivity and plasticity, leading to improved mood and cognitive function. Rapid neuroplasticity. Ketamine promotes the formation of new neural connections, a process essential for adapting to stress and recovering from depressive states. Anti-inflammatory effects. Some studies suggest ketamine may reduce inflammation in the brain, which has been linked to depression. Types of ketamine treatments. 1. Intravenous. 4. Ketamine infusions. Procedure. Patients receive ketamine through an IV drip over approximately 40 minutes. The dosage and frequency are tailored to the individual's needs. Effectiveness. Many patients report significant symptom improvement within hours of the first infusion, with effects lasting from several days to weeks. 2. Esketamine nasal spray. FDA approval. Esketamine, a derivative of ketamine, is approved by the FDA for TRD under the brand name Spravato. Administration. Administered in a clinical setting under medical supervision, patients typically take the nasal spray twice a week initially, tapering down based on their response. 3. Oral and sublingual ketamine. Alternative methods. Some clinics offer oral or sublingual ketamine, though these methods are less commonly used and require careful dosing to ensure efficacy and safety.